In this video, let's learn about the important features of the posterior cranial fossa. This is the clivus. Clivus is related to the pons and medulla. Between the clivus and the pons lies basilar artery and its branches. Then we have the foramen magnum. Foramen magnum is the largest foramen of the skull. Anterior part of the foramen will allow for the passage of the odontoid process or dens of the axis or the second cervical vertebra. It will allow for the passage of the apical ligament of the dens, membrana tectoria. The posterior part of foramen magnum will allow for the passage of medulla oblongata along with meninges, fourth part of vertebral artery, the spinal root of axillary nerve. Then, lying close to the anterior end of the foramen magnum, we have the hypoglossal canal. Hypoglossal canal, as the name suggests, will allow for the passage of rootlets of hypoglossal nerve. Lying in the same line just above the hypoglossal canal, we have the jugular foramen. The jugular foramen will allow for the passage of two important dural venous sinuses and three important cranial nerves. The two dural venous sinuses are the inferior petrosal sinus and the sigmoid sinus. The cranial nerves which pass through the jugular foramen are the glossopharyngeal nerve, vagus nerve, and the cranial root of axillary nerve, 9th, 10th and 11th cranial nerve. Lying just above the jugular foramen, we have the internal acoustic meatus. The internal acoustic meatus will allow for the passage of facial nerve, vestibulocochlear nerve, and labyrinthine artery. Apart from these foramens, the other important landmarks which need to be identified in posterior cranial fossa are the sigmoid sulcus. As the name suggests, this lodges the sigmoid sinus. The sigmoid sinus continues as the transverse sulcus, and this transverse sulcus will lodge the transverse dural venous sinus. The posterior part of the skull has a prominence in the midline. This is referred to as the internal occipital protuberance. This is related to the confluence of dural venous sinuses, or otherwise referred to as torcular hierophyllae. Starting from the internal occipital protuberance, we have a midline crest. This is referred to as the internal occipital crest. This will give attachment to falx cerebelli. The internal occipital crest diverges close to the posterior end of foramen magnum, forming a depression referred to as Vermean fossa, and this is related to the vermis of the cerebellum. To quickly summarize, the important landmarks which are seen in posterior cranial fossa are the clivus, foramen magnum, hypoglossal canal, jugular foramen, internal acoustic meatus, the sigmoid sulcus, the transverse sulcus, the internal occipital protuberance, internal occipital crest, Vermean fossa. Thanks for watching. If you like the video, please leave a like, comment, share and subscribe. Thank you.